Thank you for that kind introduction, Susan. The work that you and Michael Romita, CEO, and the rest of the Westchester County Association team do is vital to an important cause: driving smart growth, driving economic vitality, and driving economic development in Westchester and the region. This year, in particular, highlighted the need for organizations like the WCA because this was a year unlike any other. The coronavirus hit us early and it hit us hard, resulting in the most severe economic slump since the Great Depression, and with significant implications for business and job creation. New York, as you know, was the epicenter for months. In our health system, we went from 2 COVID-19 patients on March 11th to 2,000 on March 31st. It meant we had to transform the way that we operated our business practically overnight. We repurposed every space possible to double the number of beds and treble the number of intensive care beds. We were spread incredibly thin. Everyone had to be flexible and cooperative to meet the demand. Anesthesiologists worked as respiratory therapists. Directors worked frontline overnight shifts. Subspecialty nurses came back to work as ICU nurses. The pace was relentless around the clock. Every generation, if it is lucky, is called upon to make enormous sacrifices for a greater purpose, the welfare of humanity. When the world shut down, our people at Montefiore and Einstein stood up, summoned courage, overcame fear of the unknown, and went above and beyond their duty to save thousands of lives at great risk to themselves and their families. Confronted by an unimaginable disaster, they were as ready as any team could have been. The dedication and discipline, the professionalism that saved so many lives was in place long before the first COVID-19 case arrived at our doors. Their performance in the face of a deadly pandemic was what I expected of them. But more importantly, it's what they expected of themselves. We lost 27 of our dearest colleagues to COVID-19. Their memory continues to inspire us, even as we grieve. And when the history of this pandemic is written, 10, 20, 30 years from now, and the question is asked of this generation, when the call came, did you answer? The entire Montefiore Einstein community will look back and say, yes, we did our part. We made a difference. Today, as the coronavirus surges across the country, the lessons we learned here in New York during those dark early days hold true, including the importance of such simple but effective measures as social distancing, wearing masks, and washing our hands. Going forward, we must remain vigilant, continue to ramp up testing and tracing, and continue the relentless pursuit of therapeutics and vaccines. And we must recognize that there will be difficult and complex decisions. The virus doesn't respond to passionate arguments about indoor dining for restaurants. We must defeat it with facts and science if we are to have any hope of returning to the normal life that we all miss so much. Meanwhile, as the war against COVID-19 raged on, it became clear that the virus had unmasked another problem. According to the CDC, hospitalization rates for Blacks and Latinos are 5 and 4 times greater, respectively, than that of non-Hispanic whites, while the COVID death rate for Blacks is twice that of whites. For patients with underlying conditions, such as diabetes and heart disease, hospitalizations are 6 times higher and deaths 12 times higher than they are for patients without those complications. Disease is a cruel teacher. The coronavirus is one of the cruelest I have encountered. But the lesson here is beyond valuable. What the pandemic has done is expose an underlying public health crisis, a chronic disaster, if you will, that has been afflicting and killing minorities and the poor for decades. Poverty, unemployment, hunger, crowded and substandard public housing, violence, threats to public safety, limited access to healthy food. These and other social determinants of health can combine to leave entire communities at increased risk for the chronic diseases and disorders that have left them particularly vulnerable to the lethality of COVID-19. If we beat the virus, but do not address these inequities, we will have failed in our responsibilities not only as business leaders, but as community leaders and good citizens. It is in all of our business interests to have a diverse and healthy workforce. It's hard to be positive, never mind optimistic, in these troubling times. But I believe that our response as a society to COVID-19 points the way to a solution. The sacrifice, discipline, dedication, passion, and commitment to helping others that we have brought to bear on the coronavirus is exactly what we need to confront the disparities and social injustices that continue to plague us. We Americans have changed our behavior in such profound and fundamental ways to mitigate this virus. And I dare to believe that we as a people have the capacity, the nobility to summon the same selfless courage and determination to establish equal justice for all and finally prove the true strength of our shared humanity. Again, my sincere thanks for honoring the work of the people of Montefiore and Einstein by inviting me to join you as you celebrate this august occasion of your 70th anniversary. Thank you.